Good morning. My name is Ed Drozda, the Small Business Doctor, and I'd like to welcome you to Business Share. This morning, I am joined by Patricia Gilmartin. Patricia is a doctor of acupuncture and a nationally certified Chinese herbalist. She's been licensed by the Rhode Island Board of Health and been practicing in the state of Rhode Island for the last 18 years. She's an alumna of Boston University and the Pacific College of Oriental Medicines in San Diego, California. Good morning, Patricia.
Good morning.
How are you?
I'm good. How are you?
Very, very well, thank you. It's nice to meet you today.
You too.
Thank you for coming out on this beautiful sunny day. Memorial Day weekend.
Yes.
At last.
Yeah.
Well, let's jump right in here. I find the Eastern medicine to be fascinating myself, and I've often thought of it as, I look at it this way, it's been around a lot longer than the Western medicine,
Right.
and I think that there's much to be learned. And coming from a background in healthcare and medicine myself, I have a great deal of respect actually for Eastern medicine. So I want you to know this topic is fascinating to me, first of all. I'm looking forward to this conversation, and I really want to learn from you, as I'm sure that the folks listening to this program will as well. So my first question to you is, why do you do this work? What brought you here, and what keeps you going? Is your passion in helping people to achieve certain goals? Is that what brought you to this in the first place? Is it a space in which you feel particularly comfortable and adept at helping people?
I started studying herbs actually when I was at Boston University, and I realized that there was something really to that had been missing in the medicine that I had grown up with.
Right.
And that led me to going to school in California for Chinese medicine. And I came to realize there that there was a whole different way of looking at health and disease and diagnosing disease. And it was very natural, and it was very practical, and it went along with the rhythms of nature more, and it just seemed to make sense, and I started getting treated myself, and it worked so well that I really realized I was onto something pretty amazing.
Was there a particular point in your life where you either became discouraged with the mainstream or intrigued by the alternatives, or when did this begin? You said you were always aware of these other remedies when you were younger, but when did things start to change? When did you get that fire in your belly going, I gotta check this out?
Again, I think it really did start happening when I was studying at BU, and it was just an elective that I took, and I realized, there's this history, and there's a lot of information that's not being disseminated and analyzed and used from all the experience they have in the past. So it really started then. I mean, when I started my practice here, I was working with the standard things that people think of for acupuncture, back pain and headaches, which it works great for that. But I started seeing women for gynecological issues and fertility issues. And when they started telling me what their experience was in the Western realm of things, it was kind of cold, some of them felt like they were just a number.
Okay.
And that really sort of triggered, like, it's a natural occurrence to be able to have a baby. So there's got to be a way for us to get you back into your natural rhythm in order to achieve that. And for a lot of women, that is the case. Some women do have other issues, and they really do need help from the Western
surgical intervention.
Yes,
and such
exactly.
That would, okay. So I know that acupuncture comes in many pardon me, it's a modality, but there are many different uses for it. And today we're going to spend our time talking largely about fertility, because I think it's a function of acupuncture that I don't think a lot of people do realize.
No.
I imagine and having spent a lot of time in the world of OB-GYN myself, I have to tell you, yes, it's a big deal about women feeling like they're being treated as numbers and clinically cold and so on and so forth. And wouldn't it be nice if they had a better understanding of this sort of thing?
Right.
I mean, IVF is a long and not so much painful but drawn out process, not to mention the emotion behind it. Nobody can really fathom that until they're in the throes of it, of course. But you've got a totally different way of looking at things here. And so I'm inspired by your premise. It seems that you're coming from a natural space because it is a natural thing. It should not require all these kinds of ministrations that seem totally inappropriate.
Right.
Is that a fair assessment?
Unnecessary, I think, if people were healthier.
So today we're going to educate them about these possibilities that they may just not know about, and could be very fascinating for them to find out.
Yes.
So I'm part of a couple who is looking to have a child. Mm-hmm. I'm not, by the way. I'm 61 years old, and I do not want to have a child, nor does my wife. At this time, we have 2, thank you. But before coming to see you, for fertility issues, do the patients have to see a primary care physician or their OB-GYN for a referral, an assessment, or are they free to simply reach out to someone like yourself to have an initial assessment?
Yes, they can freely come and see me whenever they feel, the need. They don't need a referral. They don't need to have any testing done ahead of time. Usually, if I see someone before they've gone to, their gynecologist, it's because they've been trying for a few months and nothing's happening, so they start getting anxious. And then we start the process. When someone comes to see me after they've already started with their OB-GYN, it's fine, but they don't need to do it in that order. They can definitely start with me.
So from a practical point of view, they don't need a referral. They can self-refer, if you will. Yeah. From an insurance perspective, curiously. Yeah. Okay. Now, I surmise there are some agencies that do and some that do not acknowledge the utility of acupuncture in this capacity. Is it largely a case where folks would have to go to you without the benefit of insurance, or is there a growing acceptance of and acknowledgement of this modality?
There is a growing acceptance of it, but it hasn't quite reached the insurance realm yet. Okay. So most of it isn't covered, which is unfortunate because it could save the insurance companies a lot of money if they were pursuing that avenue.
Well, we know that IVF, for example, is exceptionally expensive. Yes. Where the average successful implantation is going to cost in excess of $75,000. Right. And that is that's a significant cost. Right. I would imagine by the same token, if successful, that your approach would be considerably less costly than that approach in the scheme of things. Considerably less costly. And ironically, the insurance companies have to catch up to this, but it shouldn't serve as a deterrent to a couple who is seeking to conceive to go to you. The fact that insurance does not cover it, they should be aware of the fact that the out-of-pocket expense is in no way, shape, or form the same as going through traditional fertility treatments. Right, not even close. I mean, unfortunately, obviously people do have to pay out of pocket, where with the insurance thing, they don't have to pay at all, so it seems like they're having to pay more. Right. In the grand scheme of things, it's much less. But I mean, beyond that, and much more important than that, it's about
getting usually the woman more healthy, and that's priceless, because she's going to end up having a healthier child, and the child's going to have a healthier life. What?
And a healthier mother as well.
Exactly. Right. I mean, getting the woman back into her own rhythm is
right.
is beyond just having a baby. It's going to be a great thing for the rest of her existence. So
at what point would someone start to come to see you? At what point would they say, hey, you know, I really should check out Dr. Gilmartin here. I should really give it a go. What is that point?
Well, I mean, if they're having any issues with their cycle, that would be one point. Whether or not they're trying to get pregnant, if they're thinking at some point in the next few years they want to be pregnant and they don't have a normal cycle,
right,
that would be ideal. If they start trying and nothing's happening, that is, you know, the other time frame,
okay,
which is usually when I see people.
So you're actually I mean, traditionally, if a couple are looking to get pregnant, typically a year is the minimum amount of time before anyone would consider IVF and protocols such as that. Usually about 12 months. I believe that's the
12 to 13 months. I mean, yeah,
on average. But you're going before that, and you're looking for dysfunctional menstrual cycles as a indicator for the difficulty of getting pregnant. You're actually trumping that. You're not waiting until we're looking to get pregnant. You're saying, you know,
right,
you're having issues here that may impact your ability to get pregnant,
right,
at least from one aspect of the couple.
Yeah, I mean, it's not normal to not have a normal cycle, so.
Right. So well, it's not normal, that's true, but you're actually incorporating that into the notion also of the ability to get pregnant.
Right.
And which I think is an approach that really bears some emphasis here, because it's the sort of thing that a lot of folks would probably overlook in the bigger picture about, you know, getting pregnant. They might not note that.
Right.
And typically you only see your physician on average on a yearly basis. Okay.
Right.
So it may lend itself to being forgotten.
Correct.
Until.
Yeah. I mean, again, if something isn't functioning the way it's supposed to, it means that there is an underlying imbalance,
mm-hmm.
and that underlying imbalance is going to catch up with you,
mm-hmm.
so to speak.
Okay.
And how it catches up with these people is that they don't have the ability to conceive. So yeah, the sooner the better.
Okay. Now, I don't think this question is too technical for your listeners. I think they would ask it of you at some point in the course of events. So I'm going to ask you.
Okay.
How does the process impact, in this case, a woman's cycle? So acupuncture, as I understand, actually I've had it done as well, is using a very, very, very fine needle, which is inserted, barely inserted,
right,
as it seems, somewhat in the very, very uppermost layers of skin,
mm-hmm.
at a particular point. How does that translate effectively into making a change? Can you just elaborate a bit on the background behind that?
It increases blood flow.
Okay.
Which increases chemical flow of all your chemistry.
Mm-hmm.
Basically, the way I like to explain it is, there's the nervous system. If you looked at a map of the nervous system in the body,
right,
and there's the meridian system, the Chinese meridian system, and
yep,
the meridians are very, they pretty much run alongside the nervous system tracks on the there's an electromagnetic field around the nervous system.
Okay.
Because that's
And the
what it is.
meridians follow the course of that field?
They're on the edge of the field.
Okay.
So when you stick a metal needle in the edge of that field, you get a response, an electromagnetic response to the metal needle, which sends a message to the brain saying there's something going on down there. We need to change, what we're sending. We need to change the blood flow. We need to change the chemistry that's going to that area.
Okay.
And in doing so, it increases blood flow to the uterus and the ovaries, and it can increase or change the level of hormones that are going to those areas, and helps the body rebalance itself to a more homeostatic state, I'll say.
And for the benefit of your listeners, homeostatic is a balance where the body being comprised of so many different components and elements actively engaged, that's them working together in a smooth, communicating sense.
Right.
If you will, in the case of infertility, okay, what is your needle placement? May I ask?
What is my needle placement?
Where would your
Usually around the ankles and the knees and the lower arms, sometimes in the abdomen.
Okay.
It depends on what part of the cycle. There's different treatments for different parts of the cycle.
So the meridians have been mapped, if you will.
Yes.
I mean, we're all familiar with the maps of the arteries, the veins. We know where the bones are. I'm thinking of the various kinds of, pictograms that we have of human anatomy.
Right.
And by the same token, the meridians have been mapped.
Yes.
And so your practice and the positioning, is needle the correct word?
Unfortunately, it is the correct word.
Okay.
I've been trying to come up with a different word because it implies something that they're not.
It is not painful. I can vouch for that.
Yeah.
There's no pain involved in this at all. But needle is, for the time being, is the word that is that describes the implement.
Right. I want to say at this point though that I think it's something like 25 acupuncture needles can fit inside of a hypodermic needle. That's how small
wouldn't be surprised at all.
And that the tips of the needle are actually rounded. They're not sharp because they're not meant to cut. They're meant to, slip through the pores, really.
And again, I can vouch for the fact I've had it done, and there is no pain whatsoever. I remember having it done for my lower back at some point and saying to the practitioner that, so are you going to do this now?
I already did.
He just laughed at me. He said, it's being done. Oh.
Right.
Okay, thanks for letting me know. I had no idea. But because of this map of these meridians, I think it's interesting to note that it doesn't necessarily mean that the application is at the location that one is looking to treat. So you said, for example, the ankles and the knees are predominant when working with the uterus and the ovaries.
Right.
Now, one would envision that we're going to be applying the needles in the abdomen because of that which we're working with, but that's not the case.
No, that's kind of the mystery of Chinese medicine.
Okay.
The needles definitely don't have to go anywhere near the problem. I think it was explained to me in one of my early acupuncture classes that there is some explanation of why the needles go where they go that doesn't seem to make any sense. It's when the nervous system and the organs are being developed in utero when you are a child or pre-birth child. The nerves that are being developed at the same time as certain organs go. For instance, when the heart is developing, there's nerves that are being developed, and one of the nerves happens to go down the arm, and that is called the heart meridian.
Okay.
So you would treat points on that meridian for a heart issue. So you wouldn't be sticking them in someone's chest. You would be sticking
Right.
them at where the similar nerve that was developed at the same time as the heart was developed when you were.
So it really goes back to the fetal development.
Exactly.
And
of the person themselves.
And again, as I say, I find it fascinating. I think it's very interesting. I'm quite intrigued by it. What is your, again, specifically now talking about fertility, what is your success rate?
It's somewhere between 60 and 75%. It's really hard to say because there's so many different scenarios that I haven't really been able to do the statistics on it properly. Like I see some women who are doing IVF, and I'm a support person with them for acupuncture. I see some people just that want to do this totally naturally. But again, those people are all having very different issues. So
right.
You can't really clump them all together, but the success rate is considerable.
That's substantial.
Yeah.
Might I ask how that compares to traditional IVF with hormone enhancement?
I believe that their success rate, and I'm not sure of this, so somewhere between like 20 and 40% success rate.
Really?
And I know that there was a study done a few years ago in Germany that using acupuncture with IVF boosted their success rate by 40%.
Boosted the IVF success rate. That's a pretty substantial, I'd have to venture a guess that would be statistically significant.
Yes.
Just a little bit?
Yeah.
It kind of makes you wonder why people are working with the other way when...
because it takes time, it takes changes that people have to make that some people aren't willing to make.
Right. Wow.
Yeah.
That's a considerable difference.
Yeah.
And something as emotional, as visceral as wanting to and being unable to conceive is it's a major consideration.
Yeah. Yeah.
Wow. I'm impressed.
Oh.
What is the atmosphere in your clinic? What's it like in there? Can you tell me?
It's beautiful, actually. It's in a nice, quiet area. There's trees outside the windows. It's nice and sunny. It's quiet. I have 4 treatment rooms. So it's just a calm, peaceful place to come. And, I sit with my patients for a long time. We discuss what's going on, what the current status of their cycle or situation is. And actually, some women come when they're doing IVF because they're so stressed out about it, just for stress relief. And then once we start talking about the situation, what's going on, they kind of, realize that there's other options. And some of them end up seeing me and just really trying to go natural. And some of them see me to help support the IVF scenario and get calm at the same time, because it's very stressful for them. And the medication can make you kind of...
Yeah.
Yeah.
Yes, those hormone injections are profound, and
Yeah. So, all around, it's a very calming, rejuvenating experience.
That's great. I could see where that would fit in. I would expect as much. Can't say I'm surprised, but that sounds very very nice. I think that's a perfect environment in which people could. Well, we all know that the emotional impact on the ability to get pregnant itself is a big deal.
Right.
If I'm,
Yeah, I end up coaching them half of the time because a lot of them have a lot of questions that they're not getting answered.
Mm-hmm.
And I know enough about both realms that I can give a pretty educated answer to their questions.
Yeah, I think that's a great balance to have, and I think and I think most importantly, and you said this earlier, is that it's clinical in a sense,
Yes.
but it's not cold clinical.
No.
It's clinical from the outcome perspective. It's not clinical from the administration perspective. That's what I'm seeing here.
Yeah, I mean, I feel like I get to know them and let them realize that I'm wanting to work with them as a team to make this happen. I'm happy, I love to do it naturally and have them have a baby naturally, because I believe that's the way, it's supposed to be.
Right.
But if for whatever reason it can't happen that way, or they're not ready to try that, then I'm happy to support them in whatever avenue they choose, and gear the treatment program to fit their needs. So it's a collaboration, definitely.
I think that's fantastic. What about the number of treatments? What's the frequency and the number typically?
I like to see people once a week.
Okay.
At least for the first 3 months.
Okay.
Because it really takes time for the body to catch on to what we're trying to do with the needles.
Yep.
Because their bodies typically are in an old habit, and the needles
Right.
are trying to move their body out of an old habit, but
Right.
they tend to slip back into it. So, and then I do a lot of charting, temperature charting with people, to follow their cycle and see what's going on with it. And once I see what the pattern of their cycle is temperature-wise, I can determine what part of the cycle might be a better time to get a treatment. And based on that, we can, try to do it every other week, or so it.
I think I can see where a couple would need coaching with that, because while it's easy to take the temperature
Right.
and to record it, it's another story to, really make use of it. You're taking it one step further, and I'm sensing this whole orchestration of the thing. I like how that feels. That's
There's
really
3 elements to it. There's the temperature, the cervical mucus, and the ovulation timing,
Right.
which you do with an ovulation predictor kit.
right.
Those 3 elements have to be in alignment within the cycle, or typically things won't work.
Right.
Usually the Western Avenue does not look at those things. They'll look at the ovulation, but they won't look at the other
Right.
elements. So there's, always the diagnosis of unexplained infertility. I feel when I see this information that they've charted themselves, that I can explain in terms of Chinese medicine what the problem is. And then based on knowing what the problem is, we can design the acupuncture treatment and the herbal treatment and the dietary treatment
Right.
to counter that issue that's off balance.
It's a holistic approach,
It is.
and because we are so, prolific and within ourselves, all the various things that we are, we need to accommodate and account for all of them, and not just for 1 or 2 elements of us.
Right.
Excellent. It's going to surprise you that our time is up, but it is. And so I would like to thank you, Dr. Patricia Gilmartin, Doctor of Acupuncture, a nationally certified Chinese herbalist. It was a pleasure chatting with you this morning. I really enjoyed this conversation, and I thank you so much for your time.
Thank you, Ed.
Have a great day.
You too.